Hello and welcome to Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I am your host, Shawn Needham, along with my wonderful producer, Lindsay. And today we have Dr. Maier from the Pioneer Vet Clinic with us, and I am super excited. He's been a veterinarian for many years now, and when we decided to do this radio show, podcast, we wanted to keep it everything healthcare. And, I will tell you, animals are part of our lives. They help us with our health, and they need healthcare also. So that's why we have a veterinarian on here. And Dr. Maier does a lot of cool stuff, and we're going to talk about some cool stories today. So thank you for joining us live on my personal Facebook page. You can also catch us at the Moses Lake Professional Pharmacies YouTube site and all the podcast forums. So SoundCloud, iTunes, Google Play, all those. We are there, and catch us there. Like us, comment, share, please. You're going to hear some cool stories today. So, Dr. Maier, welcome to our show.
Thank you.
Yeah, and so let's just start a little bit. You kind of went in to be a veterinarian a little bit later in life. Tell me about what made you want to do that, and how that transpired.
I did. I had grown up working on a farm ranch and always enjoyed working with the cattle and working with the veterinarians who would come out and help us out, and was drawn to that field. But after 4 years of undergrad, school seemed a little tedious, so I decided I was going to take some time off. I actually have an undergrad degree in forestry, and I went and worked for the Forest Service for a bit, but didn't really like that job, so I went home back farming, ranching, and got married, forgot about going into veterinary medicine. Got married, had a couple kids, actually started a custom haying operation on my own, and was doing that. Then mid-30s, remembered that I wanted to be a veterinarian. Luckily, my wife agreed to uprooting, going to Pullman, and letting me become a veterinarian. So I did graduate in 1991. I was in my mid-30s. Very good experience over there. I was worried about the kids going over there, uprooting them, but it was a great experience for them also. So it's, and then we moved to Moses Lake 1992, and then I opened my practice in 1994. For those of you that grew up here, you'll know I moved into Jack Black's pharmacy.
Yep, I remember that.
Yeah, when he retired, it was empty, and that was my first practice until Confluence bought out that complex, and that's when we built over here and moved into this facility.
Yeah, well, welcome to our community. You've been you have changed so many people's lives with some of the different animals that you've been able to work on and take care of. So we're going to talk about some of those today. So a few months ago, I think it was in March or April, the service dog we're going to talk about was injured. It was a big thing in the community and actually all over the state. Tell us a little bit of the story about, there was a Moses Lake police dog that was shot in the line of duty.
Yes.
And basically, from what you tell me, saved the officer's life. Tell me what you know about that story and how your clinic got involved.
Right. Well, we take care of the service animals in this area, and so they've got us on speed dial.
Okay.
And they were doing their routine, chasing the bad guy thing, and the guy went into a field. The police officer told him, give yourself up or I'm going to release the dog. He didn't give him up, so they released the dog. The guy was armed. He shot the dog, which once the gunfire goes off, the police officer was forced to shoot, unfortunately, the other guy. But the dog did take a bullet to the head. But they called us immediately. We had two doctors actually respond to it. They were able to stabilize him and get an IV catheter going, get everything stable. Somebody called Life Flight, and they stepped up big time. They brought in a fixed-wing aircraft for us, and they flew him out over to WSU. Since they don't have the expertise to deal with that patient, they allowed Dr. Morrison to ride with them. She flew over with them, provided all the medical care during the flight. Life Flight allowed her to use some of their medications for pain control and everything, and it all just fell into place. We were able to get him over there. They were able to stabilize him and save his life that way.
So, did you stabilize Did the veterinarians actually stabilize the dog in the field, or did the police bring the dog to you guys' clinic, or how did that work?
They did. We did not get to. I don't think they came to the clinic. I think they did meet in the field, and the doctors, placed the catheter. I believe I wasn't there. I was out of town, and then I think they met him out at the airport, our municipal airport. They were waiting out there for the fixed wing to come, and keeping him stable during that with IV fluids and pain meds and stuff.
Wow! What a great story. So, thank you, Life Flight, for doing what you did. I mean, you ended up saving a dog's life, which is definitely part of our community.
Important part of our community.
Very important. And tell us a little bit about the follow-up with this dog and how this dog is going to do. And
I checked with Dr. Morrison just this morning, and Chief is doing wonderful. He's still experiencing a little pain. It did shatter the left side of his lower jaw. So there is some pain. My understanding was if he takes a big yawn, it hurts. And he is now eating hard kibble, so he can add some pressure without too much pain. So he's back to eating good. I mean, he did lose his left eye also, but dogs, their sense of smell is so important that's not that debilitating to him. But he's doing wonderful, and he's living with his partner now. He's no longer in line of duty. He's retired, living with his partner, and there is basically an organization that takes care of these wounded warriors, our canine wounded warriors. So he has all his medical bills paid for now, and they pick up medications, foods, all of that.
Wow, that's super cool. I think that's called Project 9 Hero. And I think we're streaming it right now. Producer Lindsay, are you streaming that? And that is just super cool that there's a organization out there that will help to pay for these animals that are injured in the line of service. And I'm sure that they get donations from all over the world. So check that out, project9hero.org. So is this uncommon this dog literally saved this officer's life? Is that what I understand?
It did, yeah. He was after an armed suspect, so if he had to go in by himself, a likelihood is that he would have received gunfire.
Right. Now, it seems like, this is a very special story, but not incredibly unique when it comes to animals especially dogs, it seems, putting their lives on the line for humans. Do you see that? Does that happen often?
Well, there's a lot of stories out there of dogs, alerting their owners to intruders, to fires, to different things. You be out hiking, the dog will not leave the sight of a fallen companion. I mean, they will sit with you. They've kept children warm if they've gotten lost, until they can be found. So, they bond to us very strongly.
Yeah, dogs are just they just end up being a part of our family, and it's just amazing how, especially, my kids grew up with a dog, a big Airedale. You took care of
your Airedale, yes.
We loved Scruffy.
Big boy.
Yeah, he was. We still have not seen an Airedale bigger than him yet, but he was an awesome dog, and you took great care of him. And my kids basically grew up with him, so they were like brothers, and he would protect them like. Yep. There was no tomorrow. Especially when they were small, when there was somebody coming into our yard, he would not let anybody come in.
Yeah, no, they do. They can, and there are certain dogs that are known to be very protective of their family group.
Yeah, yeah.
And
is that more breed specific
It
sometimes?
can be, but
Yeah.
any of them can do it. But there are some breeds that are more prone to that type of behavior than others that really are protective over their family group.
Yeah, yeah. So, tell us one of the interesting things that you do quite often is you take care of exotic animals. Tell us a little bit about what is defined as exotic animal.
Well, exotics are anything other than dogs, cats, horses. Are what you think of as normal. So it's going to be the birds, the turtles, the rabbits, guinea pigs, rats, mice, snakes, lizards.
And you've taken care of all those.
All of those, including spiders. Yes, yes.
So we've had the privilege in our pharmacy. We've been open our pharmacy since 1998, and Dr. Maier has been our vet since 94 when we first had a little Yorkshire Terrier. But because we're a compounding pharmacy, we work a lot with veterinarians making medications for these special animals that there's not something commercially available that they can pull off the shelf. So
correct.
We've had the opportunity to work with some of these special stories and be involved in them. And I remember one time when we first started doing this, Dr. Maier had a case. I don't know if you remember this case, Dr. Maier, and he wanted us to make something for a prairie dog and their sinuses. and I'm doing some research. I'm like, yeah, we can do that, but it was mitotane, I think. And I said, yeah, we can do that, but it's going to be like at least $100 or something. And they're like, he's like, it's okay that these owners, they don't mind paying for this prairie dog.
Yes.
Right.
Yep.
So anyway, you remember this story?
Well, that was, I do remember that one. That was actually the very first prairie dog. Prairie dogs are notorious for being put up on a surface like this high, and then they don't, for whatever reason, don't see edges, and they'll fall off and they face plant, and they break their incisors. Their incisors are like rabbits or anything else. They continually grow. With enough trauma, it'll cause a tumor at the base of the tooth, and it'll obstruct the nasal passages. And prairie dogs are obligate nasal breathers. They cannot mouth breathe.
Oh, wow.
So when that gets big enough, they can't breathe anymore. When they first came into the pet trade, nobody knew how to deal with that. I called multiple exotic specialists that only dealt with it, and they say that's a death sentence, put it down. But this particular owner pleaded with me to try something. So I did do some research and looked at anatomy, and I came up with a plan to surgically go in and try to remove it, and was successful. And I called one of my friends, an emergency or a exotic veterinary doctor. He was really excited that I'd been able to do that.
That is cool.
And I did a few more, and they worked. And so now there's now that procedure, or different procedures like that, or that are written up and used for prairie dogs.
Well, I remember following up with you a few months after the fact, and hey, how'd that medication work for that prairie dog? And you're like, oh, it didn't. And I said, so what'd they do? Well, you talked about the surgery, and I said, well, wow, how much did that cost? It was like a couple $1,000s, is that right?
Yeah.
Yeah. And I said,
sure.
I mean, my first question was, well, how long does a prairie dog live? And your answer was something, I don't know if you remember this, like, well, that's just it. We don't really know because we haven't had them in captivity.
They've not been in captivity long enough. We didn't know all of that. And no, it wasn't a couple $1,000s.
Okay, I'm not sure. But it was an
especially
expensive surgery.
for that. But you get attached to these
Absolutely.
pets. And one of the exotic pets that people really get attached to are rats. Rats, they freak people out, but other people love them. And of all the rodents, they are the most like a little dog.
Really?
People get really attached. They're social animals, and they want to be with their owners. They love to be on their shoulders and be with them. So people get really attached to rats.
And I mean, to some of us, it's like, well, that's a rodent. That's kind of gross to me. But, I just learned over the years that a pet is a pet. And if it's that person's pet, I mean, it's part of their family. So we need to treat it like that.
It is. And rats are really predisposed to certain cancers. And people will spend a lot of money for us to remove tumors off their rats.
And how long does a rat usually live in captivity?
Yeah, the lifespan's not that great. You're looking at 3 to 5 years is pretty average.
Wow,
that's my one. That's why I don't have one. I don't like that short lifespan.
Right, it's hard enough for me to get attached to a dog and it dies 10 years later.
Yes.
I mean, a rat would that be?
Yep, I do. I like them, but I don't like the lifespan. So I don't want to get attached to something that only lives that long.
So speaking of lifespans, one of the exotics that lives the longest is some birds, right? They'll outlive humans, correct? Sometimes
birds, turtles, tortoises.
Yeah.
Yep.
Tell us some stories about that.
Well, there's one tortoise, it was a desert tortoise, California desert tortoise that was just caught by a little girl, and I've taken care of that tortoise. It's now in its third generation. So grandma, mom passed it on to her daughter passed it on to her daughter. So it is a third generation pet.
Wow.
Yeah.
Wow.
Caught by grandma years ago.
Right. And birds can live to be 70, 80 or so,
They
right?
They can. So if you adopt one of those later in life, you have to make sure that you've got somebody that will take that bird on when you die. Yes.
Right.
Yes.
Right. So tell me some things that you've done. What would you do? What would you do with a tortoise? I mean, what kind of things do you do with them? I guess they get sick too, right?
They do. Yeah. And a lot of it is nutritional, but usually once people figure out proper nutrition for their particular pet, then we don't have those troubles. So with exotics, a lot of it is nutrition. And once we can get that squared away, things do well. So, tortoises, they don't know how, they can live for a long time. I mean, the first tortoise that was brought back from the Galapagos Island by Charles Darwin died not that long ago.
Now, that was in the 1860s?
Yeah, so that one died not too long ago, over in England. So they can go a long, long time. So it's, if you're treating them correctly and they don't get injured. So a lot of it is injury. With the little turtles, dogs will bite them. So that injury, if it's a aquatic one, if you don't change the water enough, they can get fungal infections. And so there are those different things that, and then with your reptiles, metabolic bone disease. They require sunlight, and if you're not in the sunlight, they require a UVB light in their cage, and calcium, vitamin D, those type of things.
Wow. So I hope you guys are excited as I am about this. I get really super excited about this, and I'm not taking anything away from medical doctors, because medical doctors are super smart and they're great. But, at least every patient they take care of has a 4-chambered heart. I mean, we're talking about animals here that have 2 or 3 chambers in their hearts. Way different animals than a human. And Dr. Maier takes care of them. That is super cool. One thing I want you to elaborate on, or just, for our listeners and viewers, and Janet, my wonderful wife, says it all the time. We talk nutrition a lot when it comes to humans, because I think that's one thing that's really made it to where we aren't as healthy as we used to be because of our nutrition. And Janet will say all the time about what's the first thing that a veterinarian asks when you take your animal into him. What are you feeding them, right?
Right. And it's unfortunately, in North America, our health problems, or the pets mirror our health problems, and obesity is one of those health problems. They don't eat any healthier than us, and I keep telling my clients that my patient, that dog, can't go over and open the refrigerator for herself. So he's, it's not him or her that's doing it. It's the owners. So we really harp on them about proper nutrition, proper calorie counting, and it's just one chip. Well, yeah, but this is a 5-pound Chihuahua. One chip is like a bag of chips for you. So don't do it. So that's a hard part, and that's part of the bonding with our pets. I mean, they love that attention and the food, but find a healthier food. A little baby carrot. They love baby carrots.
Yep. Yeah, Scruffy loved those things.
Yeah, those are
and
good.
Apples. Scruffy loved apples. Yep. He was a big dog.
Yeah, so apples, carrots. If you got to give them a chip thing, a rice cake. They don't care. I mean, it's a rice cake. I mean, I'm not fond of them, but my dog would take it. So mainly, it's coming from your hand is what. It's that bond, and they're really bonded to us. But, yeah, so we see the obesity, and along with the obesity, we see diabetes, just like in people. So diabetes is more prone in our obese cats and dogs.
Right, and we had just a story, like Dr. Maier says, when you have little dogs especially, one chip is like a bag of chips for us. We had a story, we had a Yorkshire Terrier, and she was a lot smaller than Scruffy. She was about 10 pounds, 8 pounds. Dr. Maier took care of her, and this is a story that you guys really need to listen to because it's not funny. When we'd travel with her, like we'd go camping or whatever, people would treat her like a bigger dog. So they'd throw a hamburger out, and of course dogs are opportunists, so they just eat it all. And she would get incredibly sick, and she'd start wanting to throw up and all night long, and we didn't really know what was going on. Well, Dr. Maier says that it probably threw her into acute pancreatitis, right?
Yep.
So what happens is, well, whether it's a little dog or a big dog or a human, if we overstuff ourselves, if we overeat, our pancreas cannot keep up. So,
especially with fatty foods.
Yeah, and especially with fatty foods, because the pancreas helps to digest fats. Well, a small dog eating something so big like that, it gave her acute pancreatitis. It happened a few times, and guess what happened? Later on in life, she developed diabetes, and it's really from some people feeding her the wrong food at the wrong time, and they kind of thought it was funny when she'd eat a whole hamburger, and we didn't think it was funny, and it wasn't funny. It really hurt her health. Can you expand on that?
There is, and there's certain breeds that are more prone to it. Some of the terrier breeds are more prone to it. The way they handle their fats is different. When we draw blood on schnauzers, I mean, they have it's what they call lipemic blood. So when we spin it down and we're sending it out to the lab, it's milky looking.
A lot of fat.
The serum is milky looking. It's just the way they happen to handle the fat, and it predisposes them to pancreatitis if they eat wrong. So you just got to, find out what your dog, works for it, the food-wise, and be real careful about what you feed them.
So when we're talking about some of the exotics, let's go back a little bit on, you talked about how important nutrition is. So what do you try to do? You try to feed them as close to what they was eat in the wild?
Education. Yeah, you just, there's a lot of the more common breeds, or species, there's a lot known on their proper nutrition and what to properly feed them, such as a guinea pig. Them and humans are the only species that require vitamin C. Everything else makes their own vitamin C, but we get scurvy and they get scurvy. So they've got to have vitamin C. So they manufacture pellets, food for guinea pigs with vitamin C in it. If they're not getting that, then you've got to give them the vitamin C. You've got to give them the vegetables, like your green peppers and whatnot, to give them vitamin C, or they get scurvy.
Wow.
Yeah.
Interesting. Well, so there's a common theme here. I think when we talk about we can control three things in our lives as humans to make us healthy, and that's basically eating, exercise, and sleep. I'm going to imagine that's kind of pretty analogous to animals too. But one thing we talk about a lot is vitamin D and how important sunlight or vitamin D is in humans, and vitamin C also. I mean, these things are these are important to animals and humans alike, for sure.
Right.
Yeah. And so expand on a little bit on what's the most exotic, unique animal you've ever taken care of?
Probably one we don't see in this area much it's an animal called the Cudamunde, which is a South American raccoon.
Okay.
It's actually illegal.
Producer, can you find a picture of that and stream that?
Good Mondays. Yeah. I don't think they make great pets. I've only dealt with a couple of them. Usually we have to anesthetize them to do much because they're terrible biters outside of their own family.
Really?
Yes, but they're illegal to sell in this state.
They're illegal to sell in this state?
In this state. But if you move into the state with one, then they're legal to have. And those are the ones that I've taken care of. So they've had them as before they moved into the state. There's a lot of things in this state that you cannot legally have. I mean, some states you can have raccoons and skunks. You cannot have those here.
Is that right?
They can carry rabies, and there is no vaccine for those species. So Cootamundies are really cute, and
but they're aggressive.
Their paws and their noses feel super cool. So yes, I've taken care of those. I used to have a guy and his wife. They used to travel to me from somewhere in Idaho because they couldn't find anybody there that would deal with their Cootamundies. So we did, and we did dental work on him and stuff. And that was the first one I ever met. And I had to talk to the expert, the exotic animal expert over at WSU, and we kind of did, some phone consultations with WSU on how to properly take care of the pet, because I didn't know that much at the time about Cootamundies.
Yeah, so they're kind of aggressive, like a raccoon. It's like
they
a raccoon
they
sort
just
of?
tend to bite those that.
Yeah.
I mean, I couldn't handle it well. The owner could handle it, but I couldn't without getting bit. So that's not something you want.
No. So skunks and what was the other one?
Raccoons. You can't have
Washington
skunks,
State.
raccoons, foxes. Yeah,
Foxes, because foxes carry rabies too a lot of times.
Yeah,
or?
they just outlawed a lot of that kind of stuff. They probably don't make the best pets. I mean, I've never had one, but
yeah.
So you can't go bring a baby coyote home.
Okay.
You can't do that. I mean, people do, but you can't.
And then they bring them to you. Probably.
We refuse them. We can't.
Right.
We can't.
They can't take care of
They
them.
cannot have them. So we don't take care of them.
Wow, it's interesting. So I've heard you've taken care of spiders too. Tell me a story about a
Tarantulas.
spider.
Yes. That's one of those pets that most people that just can't even be around them, but some people love them. And probably years ago, a little boy, he brought his in. He was 8 years old. He'd had a tarantula. He got up in the morning. It was summertime. Tarantula was gone from his cage. He looked as good as a little 8-year-old would look, so he didn't find it, so he went out to play. He got dressed. He was outside riding his bike. Well, it turned out that his little tarantula pet was in his pant leg, and it fell out, and his bike ran over part of it. Yeah. So him and his mother.
He ran over it.
Yes, partly. Just he came in, and him and his mother were, upset. Obviously. Yeah. And at that point, I'd never seen a tarantula, and so again, I had to do some research, and found out that spiders. He had a broken leg. That's great. I found out all I had to do is take it off, and they regrow the leg. So
right.
So no big deal there. The little part of his body was kind of caved in where the tire had creased it. Wasn't torn, wasn't injured any. So I got online and found out that all you do with those is you just reinflate them with saline.
Really?
So needle and saline, and popped it back out. And I talked to the mother probably 6 years later, and the spider was still doing great. So if you mothers out there, if your children want spiders, they live 10 to 12 years. So they are not a short-term pet. So, I've had mothers say that, their kids have gone off to college and they're stuck caring for a spider. So just, research before you allow your children to talk you into a pet.
So we are live, and if we are taking callers, so if anybody has any questions for Dr. Maier or any great stories about animals, please share them with us. 509-537-0411. So you don't take care of any large animals, is that correct? At least not now, is that correct?
We do not. We don't do what's considered farm animals. So we don't do cows, horses, the goats, the pigs. We don't. I used to when the potbelly pigs got popular. I did used to take care of them. They just, in the clinic situation, the noise and everything was just too much, so we don't do those anymore. And they're not so popular as pets anymore either.
How big a potbelly pig? They didn't get very big, did
they?
They
didn't, but certain individuals were getting quite large.
Oh, okay.
Certain ones were, but yeah, I had a couple of lady friends that they were friends, and they had both adopted one, and they talked me into spaying them, and that was fun. Having them in the clinic. I mean, it went fine. Everything went fine, but again, that was a learning experience, and when they don't like to be restrained, they squeal, and it is ear piercing. You have to have ear protection.
Oh, it's that loud.
That bad.
Wow.
Yeah. Yep. It's bad.
So, and I suppose like farm animals and stuff that get taken care of, are they mostly taken care of, like the vets that do large animal stuff? Do they do that in clinic, or do they do that on site most of the time then?
Yes and yes. Most of there's the dairy vets. They're out on the dairies,
right? But
people will bring their horses and stuff to the vet. Yeah. And when I first got out of school, I worked in a mixed practice, and we did all of that. They brought me on board because they weren't doing any small animal, and they wanted to expand and do a small animal practice. But yeah, so I used to do that, and the dairyman would bring in certain individuals for hoof problems, or at where I was at then, they had a lot of expensive cows that they were doing some embryo transfers. And that calf was very valuable, so we did a lot of C-sections.
Okay.
They came in, they didn't want to risk natural birth, so we would do C-sections, and so that was common at that practice. And, and then the horses, we did have paddock, we had everything set up for them, they did. So, sometimes you did it at the house, sometimes in the clinic.
And you must, in order to do a large animal practice like that, you must have to have different equipment. Totally different equipment.
For the cattle, they had a tip table. So you would put the cow up against a table, you would strap it to the table, you would tip it so you could work on their hooves.
Oh, wow, yeah.
So it's completely different.
Yeah. And and from what I understand, there are some specialty clinics that all they do is like take care of cats. Is that correct?
Correct.
Yeah.
Our education is all species except for humans. So when you get out, you can specialize in anything you want to. So there are bird-only practices.
Really?
Cat-only practices. Yes, you can do do that. And then, if you want to specialize in cardiology, dermatology,
ophthalmology. I know there's
ophthalmology, orthopedic surgeries. Yes, you can do all of those also, which I think makes this profession fun.
Yeah.
Is that you can specialize as much as you want, or you can be as broad as you want.
Yeah. That is super, super, super cool. What a wonderful story. Well, Dr. Maier, tell us where you're located. Tell us, I heard your practice is expanding.
We're in the midst. We're by the high school, so near you, right on Sharon Avenue, and built that building. We moved in 1999. At that point, I was a solo practitioner. It was plenty big enough. I had 3 exam rooms. We now have 4 doctors and don't have enough space, and so we need to expand. And so we're just finishing up with our architect on the expansion, and hopefully we can get started on our remodel expansion soon, which we're looking forward to, but not looking forward to because
right.
it'll be a little disruptive, and we'll still have to work through it, and we'll see how that all goes.
So what's the latest and greatest? You talked about potbelly pigs were popular for a while. What's the most popular? What's the latest fad now for pets?
Well, I don't know what we're starting to see more when the hedgehogs got popular back in the 90s, early. They were just, kind of like wild caught. They weren't good pets. You touch them and they just ball up and, And they weren't fun to touch. They've now been domesticated long enough. Them and ferrets both have been. When I first got out of school, and the ferrets weren't very nice either.
Right,
They were huge. But they've now become domesticated, and they're way easier to work with. I saw a little hedgehog this week that had some urine in the blood. So like most mammals, they can get bladder infections and stuff, so they brought him in. But I can now do full physical exams without anesthetizing them. If we needed to see a foot, a mouth, or stomach or anything, we had to anesthetize the hedgehog just so we could see it.
Yeah.
But now, these ones now I can handle and I can pet, I can flip them upside down. They're not so scared that they ball up and do the wild hedgehog thing and have all their spines come out.
So you've seen these over a few generations, how they've actually become calmer
Pets,
as they're more domesticated. So that's kind of, from what I understand, how dogs really originated from wolves, right?
Yep.
And they basically all originated from the wolf, and they would just breed the calmest one that would hang around people, right?
Correct, yeah.
So that's kind of what we're seeing now.
Selective breeding.
Right.
It's like, okay, this one's nice, let's breed it to this other nice one, and hopefully we get nice offspring. So yeah, so it's nice to see that progression in those particular species.
That's really cool that you can follow that. So, well, that about wraps up our podcast. What are your final words you'd like to say to people to keep their pets healthy, Dr. Maier?
Yeah, I mean, just like in people, exercise, like Shawn was saying, so take your pets for a walk. I mean, that's one of the nice things about having a pet, especially for older people. It keeps you active. It gives you a routine. You have to get up. You have to feed the pet, clean up after the pet, take the pet out for a walk. So it keeps you active. It keeps the pet active, and it's healthy for both sides, and it gives you a companion, something that you look forward to waking up and being with.
Yeah, absolutely.
So it's mental health also.
Yeah, for sure. Yeah. All right. Well, thank you for being on, Dr. Maier. We really appreciate your expertise. And
appreciate you inviting me.
Yeah. So you've been listening to Health Solutions with Shawn and Janet Needham, where we have a podcast every Monday at 1 to 2 p.m. And our midweek podcast, it varies from Wednesday to Friday, depending on our guest schedule. So, Dr. Maier, thank you for being on. And please share this podcast. I love animals. My wife loves animals even more. In fact, she thought about being a veterinarian, but one of the things she didn't want to be a veterinarian is because she didn't want to deal with the people, the owners, right?
Right. Well, that's why I like veterinary medicine. I'm dealing with the pet.
Right. And of course, as you guys know, Janet is a wonderful pharmacist and loves being with people. It's just kind of on the side. So thank you for tuning in, and we will see you guys Monday.